It was about 40 years ago. I started working for a medical equipment company and there was a telemarketing job. And I was speaking with all these lonely seniors, telling them what they could qualify to get and what was available out in the community for them. And I found them so lonely, and their family have passed. Some of them didn't have kids. Some of them, the kids didn't care for them. And I'm thinking, wow, there's gotta be a way that I can help these people. And I don't know how. So along the way, I answered to an ad for a job. And when I learned what home health was and what they could do for them, I was just absolutely mesmerized, because I said, oh my God, I found what I was looking for. Can you imagine if we can just let everybody know about the services that can be provided in a home to those seniors? My husband and I decided to move to Florida because his parents were elderly and they were retiring. And I went to work for a couple of home health agencies. And I found that their lack of care for the seniors was, again, just like a puzzle that had all these empty pieces. And I wanted to put that together. So we actually ended up opening Horizon Care Services. And here we are today, almost 21 years in business. And now we created this incredible company that was able to fill those puzzles that we needed to complete the care for our local seniors. Well, in our world, there's a lot of franchises. There's a lot of companies that it's just owned for the financial reasons. And when I opened Horizon, I created Horizon to be able to fit the needs of our seniors in South Florida. It's not just, okay, you need a caregiver. No. How was your life before you needed a caregiver? Tell me about the activities you have done. How many doctors are you seeing? Give me a list of your medication. How many pharmacies are you getting your medications from? It's being able to take that one patient or one client and just dedicate a whole entire team and provide them with the best care. It's not just providing the aid, it's providing that support system of a care manager or of a healthcare advocate and putting all the pieces together. Because we're in South Florida, most of the children doesn't reside here. So we become their family. We become their advocate. So they are part of our family. All of our patients, we call them clients. A lot of people call clients. I like to call them patients, right? Because they are our patients. They are like our family. They become part of our family. We visit them on a weekly basis. I have nurses that visit them on a weekly basis to make sure that they have everything they need. We interact with the caregiver to make sure they're eating well, to make sure they're taking the medication, to make sure they're doing activities. They're not just sitting there, or the caregiver is not just on the phone and the patient is sitting there doing nothing. So, so it's really important. They are family to us. The same way we treat our patient as a family member, we also treat the caregivers the same way. They become part of who we are and part of this incredible group of healthcare providers that's called Horizon Care Services. So 60% of my caregivers have been with Horizon for over 20 years. We give back to them the same way they give it to us and to our clients, how they take care of our clients, the kind of compassionate care they provide to them. It takes a leap of faith, right? For someone to call Horizon Care Services and say, I need care for my mom. I live in New York. I live in Massachusetts, whatever the case may be. So we want to be able to select the top-notch caregivers that we would put in our own home. So whoever we would put in our own home, that's the people that we select to help all of our local seniors.